Good afternoon, everyone. Will Dupree here in the KXAN live studio. We're about to carry this announcement from Caldwell County here in just a moment. The county judge is announcing a stay-at-home order for residents in Caldwell County, so just to the area southeast of the Austin area. So let's take a listen as they issue this. It's going to take effect starting tomorrow night at 10 o'clock.
Between protecting the citizens of Caldwell County from the rapid spread of COVID-19 and keeping our local economy from collapsing. It is important to note that this order brings the number of people allowed to socially gather down from 10 people, as in the governor's order, to 0. No social gatherings of any kind will be allowed henceforth. co.caldwell.tx.us. That's EOC@co.caldwell.tx.us. Excuse me, and we'll get you an answer to your question. I'd like to go over the chronology of the county's responses and the government codes that authorize this order, and then we'll move on to the other speakers. On March 15th, the CDC guidance was issued. On March 16th, the first Caldwell County disaster declaration was issued prohibiting social gatherings of more than 250 people. On March 17th, a second declaration limited the gatherings to 50 people and extended by the full Commissioner's Court 21 days to end on April 8th, 2020. On March 18th, the third declaration was issued clarifying language regarding community gatherings. On March 19th, Governor Abbott issued an executive order. He limited gatherings to 10 people or less. And on March 27th, the first confirmed case in Caldwell County was reported as by DSHS. So, given this fact, I've decided to issue a stay home, stay safe order. It's authorized by Texas Government Code Chapter 418.1, specifically 418.1G. The county judge or mayor of the municipality may control ingress and egress from the disaster area under the jurisdiction and authority of the county judge and or mayor. Control the movement of persons and the occupancy of premises in that area. For the purposes of subsections F and G, 1, the jurisdiction and authority of the county judge includes the incorporated and unincorporated areas of the county, and 2, to the extent of conflict between decisions of the county judge and mayor, the decision of the county judge prevails. We have worked on this with our colleagues from all the cities in Caldwell County and the ISD so that we don't encounter that situation, and we appreciate all of their input into this order. Again, the county judge may control the movements of persons and the occupancy of premises. Disaster areas, all of Caldwell County, unincorporated and incorporated areas. But the governor issues an executive order that is more strict than this order, it will supersede this order. This order will continue until April 8th, which corresponds to the declaration of local disaster. Prior to that expiration, I will ask the Commissioner's Court to extend this order 2 weeks at a time from the end date of this order until the crisis is declared to be over by the CDC. At this time, I'll turn it over to Dr. Burns.
Thank you, Steve. I was asked to share some information to you today.
All right, everyone, we apologize for the audio issues that we're seeing with this particular feed coming out of Caldwell County. We're going to be switching the source of that to a different video from the county's presentation there. Once again, Caldwell County is issuing a stay home, stay safe order. It goes into effect tomorrow night at 10 o'clock. And as the county judge mentioned a moment ago, you may not have been able to hear it too well, but it goes in and lasts until April 8th. Let's take a listen one more time as this video appears to be doing so much better. I'm listening in into my ear so that we can pull that up. Yes, here we go. Okay, so this is a better feed of the county commission meeting there in Caldwell County. We're hearing right now from the county's COVID-19 medical director, Dr. Charles Lawrence.
Became very, very virulent when it was exposed to the human population. We think that it started from an animal and transmitted in itself to man. We do not realize if there's any transmission other than human to human at this point. It is a viral infection, and as such, antibiotics do not do any good. We do not have a vaccine for this as yet, so we're still in a learning curve trying to figure out what to do with all of this. There's a lot of research, a lot of late night oil burning, so to speak, to try and figure out what is the best way for us to deal with this pandemic. This virus causes various symptoms for patients. Primarily, you usually will have fever. You may have sore throat and a dry cough. One of the more significant symptoms is shortness of breath. So shortness of breath sometimes can be a very subjective symptom, and so one needs to consider then, is this shortness of breath different from your baseline? Is it shortness of breath that is occurring because you're anxious and nervous? Or is it shortness of breath because you're having difficulty walking to and from places in your house, which would be distinctly different from your usual baseline? It can also cause fatigue, body aches and pains, a lot of things that you might think could be flu-like illness. Flu is viral as well. These symptoms may occur anywhere from 2 to 14 days after exposure, so that incubation period is variable. But most patients will develop symptoms early on. There is a high-risk group of people that we need to be mindful of. Those are primarily patients who are 65 or older, and you may have folks that are in the nursing home or long-term care facilities, and you're keenly aware that those facilities have already been locked down because those people are at such high risk. Other people who are at risk, they can be younger than 65, but they also have significant illnesses. So heart disease, lung disease especially, this is a time to put in a plug for people to stop smoking. Liver disease, renal disease, all of those underlying conditions are more prone to have COVID-19 illness. So one should be very careful if you fall into any of those categories. Some people have asked about pregnant women, and as far as we know, the pregnant women are not at greater risk than the general population. They should be monitored, but to this date, we're not sure that there's any extra worry that we need to provide. There's not a guaranteed transmission from mom to the baby as long as the baby's inside the tummy. Once that baby is born, then there is some increased risk, but again, if the mom were to be positive, there would be steps taken to provide care for that newborn infant. The disease is primarily transmitted through droplets that are created when we cough or sneeze. And so what's really an important part for us all to focus on is hygiene. We're taught from a very young age to cover your mouth, okay? But rather than doing that with your hand now, it's probably preferable if you're going to cough into your elbow or sneeze into your elbow. You're not going to get disease from your elbow in all likelihood. So it's far better to do that than coughing into your hand. And as we continue with this discussion, you'll realize why. The other thing is that if you can't cough into your elbow, but you have a tissue, then that's okay. That's permissible to use a tissue. But once you've used that tissue, you should discard it. Don't leave it on a table. Don't leave it where someone else can pick it up and use the same tissue. In effect, if we've done that, we may have allowed transmission of the disease from one person to the other. Again, the disease is transmitted person to person through these droplets. It is something where that's why you hear so much about social distancing. We're trying to observe that here in the chamber today, and you will see if you've been to HEB or pharmacies or other places where there are little blue steps perhaps, or steps of some sort that have been placed on the concrete flooring to allow you to have adequate spacing. And the reason for that is that if we were to cough or sneeze, Then we aerosolize, we produce viral particles into the air. And it's conceivable that if someone is close enough to that, then they could perhaps become infected from that person's cough or sneeze, if in fact that person has active COVID-19 disease. So we need to be very careful in regard to our hygiene measures. Another way of transmission is that you can, through your hand touching certain objects, inanimate objects, the tables, the light switches, etc., things that are not human, things that are not alive, but when we cough and we don't cover, then those viral particles could be placed on those surfaces. That in itself is not contagious to us directly, but when we touch those items, whatever they may be, with our hands, and then we touch our face, we in effect have transmitted those viral particles from that surface to ourselves. And that's where the rub comes. And so we all need to be very mindful of our exposures in that regard. Along those lines, then, there are certainly efforts to say, okay, I need to keep everything clean in my house. I'm going to disinfect things in my house. So that would be a key part of what you'd want to do. Numerous products are available for that. I'm not going to mention names specifically, but the disinfectants, as a general rule, are going to kill this virus. The virus is very sensitive to that. Even though it's teeny tiny, we can't see it. It is the invisible enemy at this point. It is very susceptible to certain ways of minimizing our exposure to that virus, and disinfecting is a key way of doing that. So we all need to be very mindful of that. Sustained exposure is another major factor for people contracting the disease. So if I'm passing someone across the street, am I going to give that person disease? The answer is no. If someone bumps into me at the store, do they automatically give me the disease? No. But I should be very cautious in regard to what I do, because we don't really know what that encounter may have caused. So again, hygiene is really the critical issue for all of us to focus on. A lot of the people that you've heard on TV have commented about this being a war. And in wars, there are kind of rules of engagement, so to speak. I think we're familiar with that term. And so I think as physicians, we probably should emphasize those rules to people so that they will know. And that really enables us in a huge way to take advantage of the opportunity we have to stop the spread of this disease. The best way of trying to prevent that is simple hygiene measures. You've heard, I'm dating myself, but the old commercials that would say, "Wash your hands, Roger." Well, you need to wash your hands. Use soap and water if that's what you have. You need to scrub for at least 20 seconds, and so there are different ways you can do that. You can count if you wish. You can say your ABCs like the kids do, and by the time you get to, now I've said my ABCs, tell me what you think of me, that's been 20 seconds or more. And so that's an adequate time for you to cleanse your hands. Once your hands are clean, then at that point, you should be safer than you were before you started your hand washing. If you have hand sanitizer, and there are numerous products that are available for that, most of those are alcohol-based, and that too is very potent in its ability to kill this virus. It just does not hold up under those conditions, and so that too is a very good way of helping to minimize your exposure. If you're outside of your house, because most people will say, my house is my haven, so I'm going to take care of that. So you're going to clean your house really well. Inside, you're going to clean doorknobs and handles on the faucets, the toilets, light switches, et cetera, et cetera. You're going to do those things probably to keep yourself safe. Once you leave your house, though, there's a greater risk for exposure. Not to say that we have to worry in a huge way for that, but we just need to be mindful that we can do several things to minimize our risk by being out in the community. Judge Hayden's stay at home and stay safe is just one other way of us accomplishing that goal. It may be an extreme, but under the circumstances, is it helpful? It will be. We've all heard people on TV comment about flattening the curve, and what they're talking about is ways to prevent spread of this disease from one person to the next. And so everything we're talking about in regard to the hygiene speaks to that very issue. And so it's not that we're being punitive. The enemy is the virus. It's not Judge Hayden for initiating this order. It's not our governor for certain declarations that he's made. It's not for the president because of his recommendations of things that he's doing. It's in an effort to keep our country, our state, our county, Lockhart, safe. And that's the gist of it, okay? If we do that, then I think that we'll be all in good shape. So we can't emphasize, how hand hygiene plays a major part in what we're doing to prevent this disease. But think of it like this, too. If we really focus on that, we can really make this pandemic go away. Will it go away overnight? No. Okay? But it will make a significant step in the right direction to accomplish that goal. And so we need to all try and do that. Once you leave your home, if you have hand sanitizer available, take that with you. And in that regard, when you're at the shopping cart, if there are not wipes available for you to clean the handle, because you don't know who touched that before you did, then use your sanitizer and clean that handle. When you're in the store, stay a safe distance from people, especially if they're coughing and sneezing and what have you. You don't really know exactly what all is going on with those folks, but under those circumstances, it would be best to say, I'm going to steer clear of them. And encourage people then to also use good hygiene measures. If you see one that's coughing and spitting and sputtering and they're not covering, ask them, say, hey, would you mind covering? And there's nothing wrong with doing that. As you've heard before, we are all in this together. And if we do it all together, then we're likely to succeed. And so that's the important part of what we need to do. If you're out and about, remember that things that you're touching, the gas pump, the store doors and handles, we're not sure about what those are, who may have touched those. So if you touch them, then just use your hand sanitizer and clean your hands. It's as simple as that. The other thing to do is, again, do not touch your face with unclean hands. That's a difficult one because we all do. From birth, if you think about it, everything that we've done goes to our face or our hands or our mouth. What do babies do when you hand them something? Goes straight to the mouth. So we've kind of had that ingrained into our being since an early age. And so it's important for us then to say, wow, we need to really change what we're doing here. And so if we can make those changes, it will help in a huge way. Because touching those inanimate objects that may contain the viral droplets, coughing into your hand and then touching other people or other things are ways that this virus is spread from person to person. So in an effort to minimize that, limit your touching your face. Try not to do that. And that's a difficult one, needless to say, because we all do it unknowingly. One way of doing that is, if you have the need to train yourself, is when you're at home, wear a bandana. What does that bandana do? It's not really protecting people around you from things, but what it may do is prevent you from touching your face, touching your eyes, touching your nose, having your fingers in your mouth. When people are turning pages sometimes, we frequently will turn the page and then we go and do this, okay? And that's a horrible thing to do. We don't think about it, but we do it. And so there are so many things that we need to retrain ourselves about with regard to hygiene and touching our faces. And if we do that, it will significantly impact then the spread of this disease. People often ask about masks. Needless to say, the personal protective equipment, PPE, masks that are the N95 mask, even surgical masks, are at a premium. Literally, if you're buying those, you may be paying premium prices as well. So it's something where, do you need those? The answer is typically no. Healthcare providers, hospitals that are caring for people who are really ill, they're in need of those far more than we are in the general public. So is it important to say, hey, I've got some of those things at home, maybe I could share those? And I would say, sure, share them. People are also repurposing those or reusing them, if you will. So it's like I've got a stash of 50 million N95 masks. It'd be nice to share those with somebody who could use them because I'm not going to use them. So you can. And save yourself a mask. Save yourself a mask or two if you wish. But there are ways that you can disinfect that mask, and it can be reused so that you're allowing then that resource to be provided to people where it's really needed. And so I would encourage people to think about that. You hear a lot about homemade masks, and there's hardly a newscast that's broadcast that you don't see people making masks. And those are not necessarily a bad thing. They will remind us not to touch our faces, which is good. But are those going to protect us totally? The answer is we cannot rely on that and that alone. What's key is hygiene of our hands and not touching our faces. If we do those two things, then you significantly impacted this disease in a huge way. We've already touched on the social distancing. That's difficult because as humans, we're social people. We are. And so the thing I would say is you can still socialize. Right now, this is being broadcast over Facebook. Is that right? So how do you speak out to people? Facebook, if you have that option. There are other media modalities that are out there, and if you're really into that stuff, then I'd say fine, use that. You can always use your telephone and call people. One thing to remind yourself, though, make sure that you're using care in regard to your phone. Where's your phone usually? Right next to your face. Where'd you put your phone? I don't know. I left it on the counter and somebody else touched it. Who knows? So you want to make sure that in your cleaning routine that you also clean your phone. It's not something to omit because we use them so frequently. So that's an important part of what to do. You may see people coughing and all that in the community. That doesn't automatically mean they have disease. We're in Central Texas. Oak is bad right now, and people will sneeze and cough because of their allergy. But again, hopefully we're all trying to minimize exposure by coughing into a tissue, coughing into our elbows, covering in some form or fashion to minimize that cough, not aerosolizing any viral particles if in fact we are ill. So that would be an important part of what to do. You may at this point, not only by Judge Hayden's recommendation to stay home and stay safe, it would be appropriate to also close your social circle. And by that I mean you may have friends, but now is not the time to ask them over for a barbecue. Be with your family, make sure that they're safe, but now is not the time to have other arrangements made and to have other people coming over who may, in fact, then carry the disease into your own home. You should not view everyone, though, as a disease carrier. It's just important for us to realize that it is in our community, it is in our county. We already have one case already, and there will be more. Lord only knows how many people will become infected with this. The good news, if there's good news about it, is that the majority of people who contract the illness, especially if they're healthy, recover. Most of those people, I think on the governor's briefing yesterday, he mentioned that only less than 10% of those people are actually going to the hospital when they're sick and requiring hospitalization. So that means that 90% of those people or more can stay at home and be treated successfully at home without cause for alarm. So again, that's reassuring. So we all need to work together in regard to trying to make that happen. Since we are social people, it may be difficult to distance yourself. It's really something where we want to do that, though in a big way. The fist bump may go away. The arm, elbow may still be some way to say hello. The newest thing is, hi, how you doing? Okay, and so you make a heart, And that's there's nothing wrong with doing that. So it's another way of helping us in to communicate that, hey, I care about you, but at the same time, I want to protect you as well. Okay? So we should smile at people. We should be cordial. You should not view people as the enemy. They are still your friends. They are still people that you see in the community. It's just that this disease is the enemy, and that's what we need to defeat. Okay. When you're at home, disinfecting surfaces, we talked about that. When you're away and you're touching different things, just be mindful of cleaning those surfaces. I guess one thing besides the telephones that we need to be cell phones that we need to be very cautious with. We are very sedentary people now. And everyone has multiple remotes, so don't forget to clean your remote. We are also computer savvy, and people are on their devices frequently, and so you need to make sure that you clean your touch screens, whether it's your iPad, your screen on your computer, your keyboard. Those need to be cleaned as well. So there's a lot of things to think about with this, but if one does that, you're really covering the bases of what to do. We as a community in Lockhart, as far as the physicians are concerned, and I've spoken with numerous physicians that are practicing here, we are trying to communicate with each other in an effort to share information about this disease and optimize the care for our patients. We took an oath a long time ago that we would do no harm, and so we all need to try and do that. I think it's an important part of what to do. The thing about screening patients, that's an important part of what's due. So when you are receiving a phone call, you're calling your doctor's office, and they're asking you questions. They're doing that as an effort to try and minimize you coming to the office if you're sick, and us not being prepared to see you for that. The norm right now is that if you think you're sick, you should stay home. That's been emphasized numerous times for your work. If you're sick, you should stay at home. Call your employer, let them know you're ill, and you should stay at home. If you are ill, then there's a greater likelihood of you spreading disease to other people by person-to-person interaction. And so we can minimize that exposure by staying home. If you're sick and you call your physician, you'll be asked a lot of questions about what's going on, and depending on the answers that you give, then determinations will be made in regard to how you will be managed. It's not that the doctors don't want you to come to their office, but we want to try and minimize this exposure to everyone, including the doctors, the healthcare providers, whoever they are, and our staff as well. Along those lines, too, people frequently ask about testing. Contrary to popular belief, testing is not readily available. You will see in the metropolitan areas that they now have certain testing centers, they have drive-thrus, etc. But even people who go to those, they're screened, and if in fact they do not meet criteria for testing, they are not tested. And the reason for that is, again, there's a limited number of testing that we have available. Those now are being prioritized into locations like the hospitals. Those people are being tested. Some of the local surrounding areas, I think they're testing if they are admitting their patients to the hospital. If you're not admitted, then you're not guaranteed to have a test. The good news about the testing, too, though, to allay your concerns about that, is that until we have an abundance of testing that we're able to test people, don't hang your hat on saying that's the thing that's going to make or break us, because it may not. Statistically, when the governor gave his briefing yesterday, in the state of Texas, there were some 25,000 plus tests, and of those, only 5,000 of those were positive. So that's 10% of the people that tested were positive. That means 90% were negative. So does everyone need a test? The answer is not necessarily. So it really depends on the circumstances of what's going on and your healthcare providers are trying to use that information as best they can to determine what's best for you and for everyone else. So let's keep that in mind. Until we have tests that are more readily available, then all of the things that we've discussed today, hand hygiene, not touching your face, sanitizing as best we can certain things where we may pick up the disease, all of those are means of our defense. And right now, that's what we should do. And if we do that, we can significantly impact this disease. Diseases are reported as confidential. And so sometimes people will say, well, who has this disease in our community? Where is this one case that's in Caldwell County? Well, again, we all have our dignity that we need to protect. We all want to provide our privacy. And for that very reason, there is a section of the Texas Health and Safety Code that provides for confidentiality in regard to communicable disease. And so for that reason, you will not see people named specifically for them being a positive case of COVID-19. And that's, again, just put yourself in the position of if you were that person, what would you want to do? Or what are people going to think? The last thing we want to do is to place a stigma on people. We don't want to point fingers and say, you're the reason that it's here in our county. We don't know. Community spread is just that. Community spread in our location. Those people don't know necessarily where they contracted the illness, but they got it. Okay? So it's incumbent on us then to not point fingers, but to do what we can do to help protect each other. And so doing the things that I've discussed earlier with you, I think that's the most important thing that we can do.
All right, thank you, Dr. Lawrence. That was very informative. We're going to go ahead and go to Hector Rangel. He's our Emergency Management Coordinator, and he's going to discuss the status of the Emergency Operations Center.
Good afternoon in Caldwell County. My name is Hector Rangel. I'm the Interim Chief of Emergency Management for Caldwell County, and I'd like to give you a quick brief on our Emergency Operations Center. The Caldwell County Emergency Operations Center has been in operation since March the 16th at a county level of UPCON 3. Our operational hours are from 8 a.m. to 5 p.m., but they could change at a moment's notice and go to longer hours depending on the severity of the case we have with COVID-19. I have a partial team of 8 people right now, and all those people are ICS certified, Incident Command System Management Team, and they're working in logistics, planning, operations, and so on. Also, at this time, we're requesting resources from the state of Texas under the State Assistance Resource Services known as STAR. But I will be asking all the medical services here in Caldwell County, being veterinary services, dental offices, and other medical services that are not servicing patients that have COVID-19. If you have proper PPE or personal protective equipment that you can donate to the Office of Emergency Management, please contact us because we're in need. I have requested a lot of the resources from the state of Texas, but a lot of our resources are not being fulfilled because there's not enough in the state of Texas to go on. Also, the Emergency Management Office has a website that's going to be, I'm not sure if it's active yet or not, but we've been working on it, and it should go active today. On that website, there's a lot of information, both federal, state, and local. And by you going to our website, everything has a button on it. You click on the button, and that information will take you to another page or another web link. And there's a lot of information from both CDC and our local medical services here in Caldwell County. At this time, if you have any information, there is a hotline that you can call, and if you have questions, please feel free to call us. There's also an email on there where you can email us if you have questions and don't have a phone or don't have another way to contact us. And that's all I have for y'all. Thank you.
All right, we're going to move to the question and answer portion of the press conference, and we're going to begin with you, Hector. Can you tell us, and Dr. Lawrence touched on this a bit on privacy reasons, but why can't you tell us who the confirmed positive person is within the county, where they live, and can you explain the process that goes along once we are notified of a positive case?
Yes, upon confirmation from the Department of State and Health Services, the only information that's provided to me from the state is gender and age. This is to protect the patient under HIPAA regulations, and no other information is provided. Now, there will be more information provided as the investigation proceeds and is complete. But at the moment, when we get a confirmed hit of a coronavirus in Caldwell County, all I get is gender and age.
Okay. Can you also tell us why we don't have any testing sites in Caldwell County?
The reason we don't have testing sites in Caldwell County right now, I have submitted requests to the state under the STAR request, which is the State Assistance Resources Services, and I requested for a full FEMA testing center. That testing center was canceled because they do not have the resources available at the present time to fulfill that order. But that does not mean that we will not get a testing site. That just means that we will be in queue when one becomes available. Now, don't feel bad that we don't have one here. There could be one coming soon, but it's unknown at this time when.
All right, thank you, Hector. The next couple of questions are for Judge Hayden. Judge Hayden, can you tell us why you issued the stay-at-home order after only one confirmed case in the county?
Yes, I'd be happy to. All public officials, first of all, when we take office, we take an oath to protect the health, safety, and welfare of our constituents. I put the threshold at one case. In the absence of that, is kind of answering a question with a question. If you don't do it at one case, do you do it at 5? Do you do it at 50? Do you do it when we have a fatality? And so I chose to do it at one case. It's important to note that this is a stay home, stay safe order and not a shelter in place order. Businesses, they're essential businesses. Those folks can go to work. You can still go to the grocery store. You can still go to the park and exercise if you practice social distancing. But we issued the order because we had one case. We know COVID-19's here, and we want to prevent the spread of it as much as possible.
All right, Judge, can you also explain the difference between a shelter-in-place order and a stay-at-home order?
Sure. A stay-at-home order is what I was just describing. No social gatherings of any kind. You may exercise as long as you practice social distancing outside. A shelter-in-place order is what you hear when there's a tornado coming, and we tell you to shelter in place and don't leave your residence until the tornado has passed. Obviously, with the duration of this, we can't tell you to shelter in place until this tornado has passed. It's going to go on for some weeks yet. So we issued a stay home, stay safe order. It's good until April 8th, and then I will ask Commissioner's Court to extend it 2 weeks at a time going forward until we've made our way through this issue.
Okay, and is there a curfew with the order?
There is not a curfew with this order. We chose not to put a curfew in place. That could be modified at some time in the future by Commissioner's Court should it become necessary. But I feel that the citizens of Caldwell County have already done an excellent job of doing social distancing, following all the things that Dr. Lawrence just outlined, and being responsible. So I would say at this time it's not necessary.
Okay. And another one of our very common questions on social media is, how will the stay-at-home order affect Meals on Wheels and other restaurant delivery services? Okay,
so Governor Abbott's obviously a much higher ranking official than I am, and he's asked that dining rooms be closed and restaurants be allowed to have takeout. I know most restaurants are being very careful with how they exchange money and so forth. They're trying to do it electronically. With Meals on Wheels, I actually checked on that a little earlier today, and this was the response I got. Last Friday, we sent out shelf-stable meals to all of our participants. Those meals include one lunch a day for 5 days, as well as cookies, crackers, applesauce, etc. We will continue to deliver frozen meals 1 day a week to cut back on face-to-face contact with our participants. And they'll leave them on the porch, knock on the door, step away until the person comes out and gets their meal. And so that's how Meals on Wheels is handling this situation.
All right. We also have a question, how will the ordinance be enforced?
Okay, so this ordinance carries with it a $1,000 fine and or 180 days in jail if you violate it. I'm asking the cities, the incorporated areas to use their police departments to enforce this order. We'll be asking that a warning be issued first. We don't want to go straight to punitive measures. If you are caught in violation of this order more than once, you likely will get a citation and a fine. If you continue to violate it, you face the possibility of going to jail. In the unincorporated areas, somebody like Joanne or the Sheriff's Department would be the ones enforcing this order.
Okay. And since Caldwell County includes the San Marcos River, how will this affect people recreating on the river?
Okay. The first way it will affect it is that the tubing outfitters are not essential businesses, and so they will be closed. If you're swimming in the river for recreation by yourself, that will probably be permitted. If you're floating down the river in one or more, that's going to be considered to be a social gathering, and we're going to leave that to the discretion of our officers. But I would discourage that type of activity.
Okay. All right, the next couple of questions are for Dr. Lawrence. Dr. Lawrence, if a person contracts COVID-19 and makes a full recovery, are they immune or can they get the virus again?
Well, that is a good question, and we're not sure of the answer. With any disease that we acquire, usually your body will make antibodies, and your immune system will kick in and do certain things. But since we don't really know the overall nature of this specific coronavirus, then that is something that we're still trying to figure out. As I mentioned earlier, the coronavirus is in the family of the common cold virus. So the thing is, you may get a cold in the winter, you may get a cold in the summer, but you get a cold more than once. So the question is, what's going to happen with this coronavirus, COVID-19? And the answer is we don't know yet. It is something, though, that we're thinking that our bodies will mount immune responses, and as time goes by, that viral virulence, the potency of the virus to do certain things that are bad to us, will probably fade. And so at some point or another, you may have exposure to COVID-19, but it may not do a thing to you other than cause just a cold. But at this point, we can't be cavalier and address that in saying, oh, it's no big deal, because it is.
Okay. And can you also answer whether pets or animals can contract COVID-19?
Well, there are, again, feline and canine coronaviruses. And so within those animals, they can have the disease. But as far as we know, there is not transmission from human to animal. So if you have a pet and you're not sick, then you should continue to do exactly what you're doing with that pet. If you are ill and have COVID-19, then it might make sense for someone to care for your pet, and you might want to minimize exposure, at least until we know more about the disease. But to that extent, that's how I would answer that question.
Okay, great. Okay, so we currently have the Stay Home, Stay Safe order, and that will be posted on the county website today. The order itself contains many answers and a large frequently asked questions section. So if there's something you're not sure of whether it applies to you, please see that order and read it in its detail. And if you're still unable to find an answer, we'd be happy to answer that. You can contact us at the Emergency Operations Center. The phone number is 512-359-4637. And if you have any medical questions, you can contact Ascension at 833-919-1680. That's our coronavirus hotline. At this time, this will conclude our press conference. We thank you for joining us.
Well, Dupree here in the KXAN live studio. You've just been listening to the conclusion of that press conference that was held digitally from Caldwell County, where the county judge has now announced a stay-at-home order will take effect tomorrow night at 10 o'clock in that area. Again, that's the Lockhart area and other communities within Caldwell County. The judge there said that he wanted to issue this stay-at-home order because this weekend the first confirmed COVID-19 case was announced in that area. So he said they heard the one case, that was enough for them. They're going to issue the stay-at-home order to protect people following the examples of Travis, Hayes, and Williamson counties, which all are very close to Caldwell County. So that's the new order that's going into effect, again, tomorrow night at 10 o'clock. I've been looking at some of the comments on our Facebook live feed, and some people are asking, why is it going to effect at that point? This is to give people some time to get used to this and to get things ready and prepared for this particular order. That's why they're delaying it just a little bit, again, going into effect tomorrow night at 10 o'clock in the evening. I also wanted to point out that the emergency management official who spoke there also said that Caldwell County does not have a testing site at the moment for COVID-19. We obviously want to ask some more questions about that, and if somebody has symptoms in that particular area, where do they go? I would imagine that doctors in that community and then in that area would be able to recommend people to go to certain testing sites, perhaps further away from their homes, maybe like here in Travis County. So we'll ask about that and try to get some clarification on it too, because that definitely raised my concerns as well, hearing that just a moment ago. The county judge has said that this stay-at-home order will last until April 8th, and that's because the current disaster declaration for that community will end at that time too. However, the county judge said he will plan to ask for it to be extended if it needs to be, and he expects it to be at this point, and then at every 2-week period they may extend that. So there will be some things to follow within that community, and we of course will pass along that information as soon as we hear it with all of you, because I know you're keeping a close watch and paying attention to all this.